In the current projections for the budget that passed in April, we have about a 12% increase in spending built into that budget, and we have a decrease of almost 6% in revenues. So, those lines, those graphs, as you can see, are going in the exact opposite direction, and certainly the revenues are continuing to go in that direction. So that is the situation that we're presented with, and it's not something that has been, just the last year or even the last 2 years. If you look at, slide 25, which is almost the last slide here, you'll see that over the course of the last, 10 years, the budget really has grown significantly. The bar to the left, it's in black and white, your copy, saving money once again, double-sided. The right-hand column, the higher column, is the actual figure, and inflation, the normal inflation rate is to the left. So you see the growth there. The major drivers on the next slide, of course, as you see, Medicaid and school aid. I think the budget that you'll see next week is really an effort to share sacrifice amongst a number of sectors, all the sectors, I should say. The governor has committed to that. Certainly the November budget, I think, indicated that given the real depth of the crisis, given the need for significant savings, we need to, of course, ask every sector to contribute to meeting this deficit. And with regard to Medicaid and school aid, given, as you can see, their significant portion of the chart, they will be, of course, asked to share proportionately. It's important to say, we are very proud, as I know you all are, of New York State's Medicaid program and the level of services and the level of care that it provides to its recipients, beneficiaries. So this is not about saying, our Medicaid program is not a good program, or our Medicaid program needs to be scaled back, in any kind of radical way. It's really about the next slide, and that is that even with all the money that we're spending, we seem to have all of these quality and care gaps in the program. And that is really what our reform agenda is trying to get at. Yes, we have a cost containment goal this year that is quite large. But we continue on the reform agenda, and as the Commissioner Deborah will also reiterate, we feel it's an imperative to continue that reform agenda in order to increase quality, make sure we're spending the right amount of money, and frankly, flesh out or jive, as it were, with the Obama administration goals as well for a high-performing healthcare system nationally. You see our next slide talks about the quality indicators. And the fact that, New York, at best, is middling. We certainly were excellent at some things. Once again, this isn't an indictment of our providers. It's simply the facts. Our quality is not as good as it should be. And many other states have middling quality, but they don't spend the kind of money we spend. So we're trying to, for what we pay, we should have much better quality indicators here. And as you know, and Deborah will talk about, what our feeling is in the acute care or hospital sector is really moving what we feel are, overpayments in the inpatient area to the outpatient area, where we think we would have significant progress in these quality indicators. In other words, we really feel the gap of primary and preventive care, of the medical home, of folks not getting that day-to-day, month-to-month, year-to-year care for chronic, ongoing conditions is one of the reasons, if not the primary reason, that we have these gaps in quality. So balancing our system and beefing up our outpatient and community-based or hospital-based outpatient community-based care is key, and that's what we're looking to continue. We're also going to take a look at the long-term care side of the ledger this year. And some of what that is based upon some statistics that I also present here. As you can see from this lovely pie chart that's not in color but is shaded good enough in black and white, nursing facilities, nursing homes, are a majority of what we're spending in the long-term care area, about 59%. And the next slide shows us that New York spends twice as much as the national average, but overall our quality is not appreciably better. I mean, it's not double. The national average in quality is 3.11 Medicare stars, and we're at 3.41 Medicare stars, but we spend double the amount of money. So once again, we need to look at what we're doing in order to say, if we're spending this much money, we should have, 5 stars, and we don't. So if we don't have 5 stars, what's preventing us to get there? And how is that reimbursement methodology affecting the incentives and driving the kind of care, or not driving the kind of care that we need to get? The next slide shows that our costs, or our spending in the Medicaid nursing home area has been increasing really exponentially, as you can see here, and certainly with the rebasing methodology that will come into effect. And we had some transition payments in this year for retroactive periods, and as of January 1, it'll go into effect, and that's what you see, the $600 million, and we're still trying to estimate exactly what that would be over a period of time. Those numbers are all going up, and yet the number of folks in nursing homes is either staying the same or actually declining. Once again, that, I guess, what would we call that, a Jaws chart? We got, the jaw is widening. We're spending more money, but we're spending them on less people. And our quality is not improving. Because you would say, okay, well, that's great. Our quality should be stellar, and it's not. So we've definitely got something there, an issue that we have to drill down into and look at. Home-based care. Home-based care accounts for about 37% of our long-term care spending. And once again, you can see on the next slide, we've got a significant difference between what we're spending, particularly per beneficiary. If you look at the bottom there, just the numbers, not the chart, but the numbers, $5,900 versus $3,700 for California. But even our total expenditures, I'm sure California and we are kind of neck and neck in some instances, but then it really drops off the chart. Once again, I would say we don't want to do what Texas is doing necessarily, although we look at Massachusetts. But I mean, we know we have a generous program. It's not about curtailing generosity. It's about whether or not we're getting real value for the money that we're spending. Once again, if you look at the next slide, our spending is going up, and we don't have a line here for our beneficiaries because I'm not a very good PowerPoint person. But our beneficiaries are actually, once again, going down. So we're spending more money on less beneficiaries, and we've got to take a look at that. One reason may be our next slide, and that is as Medicare has changed its reimbursement system, it seems like we're getting offloads from the Medicare system. And so that's something that we need to take a look at and figure out, why is our payment methodology antiquated in both this area and the nursing home area, and how can we provide better incentives to provide, because our goal is always the right care at the right price in the right setting, and to really make sure that we have that continuum of care so that you can either come from a hospital to home care, or from a hospital to rehab in a nursing home to home care, fine. In the long-term care setting, start out with home care, stays home for as long as one possibly can, if not, up until the end of life, but then move out into the nursing home appropriately when that is actually what is needed. And rebalancing that is a system, is really something that we can do in our reimbursement system, and that we're going to make some inroads in the context of this budget.